Hello everyone, welcome to REVERT Hair Clinic Dehradun YouTube channel. I'm Dr. Amit Singh and I'm a hair transplant surgeon based in Dehradun. Today in this video I'm going to discuss a very important topic. The topic is important because this is the stepping stone to decide at which clinic you should get your hair transplant and other hair loss treatments done. Hair transplant being a surgical procedure, the most important thing for everyone to remember is that you have to get that procedure, hair transplant, done only by a qualified doctor. This criteria should never be bypassed for you to get a good result and to have a very safe procedure. So if you are planning to get your hair transplant done, visit that clinic, meet the doctor, the surgeon who will be performing your surgery, get his degree checked. He should be a surgeon who has an MBBS MS surgery degree or a dermatologist with an MBBS MD dermatology skin and VD degree. His degree should be written on the OPD card which will be given to you when you consult him. And the other thing, you have to make sure that his or her registration number is also written on the OPD card. The registration, every doctor who is practicing medicine in India is given a registration number by the state medical council or an all India medical council. So that doctor should write his registration number on every prescription or every card, on every prescription card he issues to his patient. So one should make sure that his degree as well as the registration number is written on the OPD card. The other thing that is important is that the hair transplant procedure should be performed in a proper operation theater which have all the required facilities to perform a surgery. Not only a hair transplant surgery, the operation theater should have all the emergency medicines available, all the oxygen cylinder and everything that may be required in an emergency, and the operation theater should have sterilization machines. Proper instruments should be autoclaved and then only be used. They should have proper training of their staff to wear the surgical gowns and the gloves. They should be properly trained, and that can only be possible under the supervision of a surgeon or a registered dermatologist. So make sure you confirm these things first, then only proceed further to inquire about the procedure and other things. Regarding the hair transplant procedure, the technique we use in our clinic is called DHI hair transplant. DHI stands for direct hair implantation. DHI is presently the latest technique by which hair transplants are done worldwide in established hair transplant clinics who have good results, because every surgical method or anything, certain modifications come regularly to make the procedure more safe and to give a better result. So in DHI, all the shortcomings which were present in the previous done procedures were rectified, and presently DHI is the best method to perform a hair transplant. What is the difference between the regular, the old method and the DHI method? I would like to tell you the basic difference. There are 2 or 3 basic differences between DHI and other methods. In the old method, the roots which were extracted by FUE or FUT, when we used to implant them in the frontal area where the roots were required, the surgeon used to make slits, the small holes, and their support staff used to hold every root that was extracted with the help of the forceps, and with that forceps he used to insert that root into that hole. By using forceps in insertion, around 20% roots used to get damaged because holding them by forceps, they used to bend some roots while trying to forcefully insert into the hole used to get damaged, and at least 20% of the roots that were extracted were damaged at the time of implantation only. To rectify this, DHI uses a special instrument which is called implanter. Implanter is a pen-shaped instrument where roots are loaded inside, and the staff, the technician, holds that pen in his hand and put that pen around that hole and just pushes the button which is there on the top of that implanter. He doesn't have to see the root, the hole where the roots are being inserted, and also he doesn't have to hold the root while implanting by forceps. So it has 2 distinct advantages: that roots are not damaged while implanting, and the second advantage is that we can give more density as per requirement of the patient. In the previous method, because the slits have to be made wider so that the both ends of the forceps were used to insert the root. By implanter use, the slits are minute holes, so the density, the adjoining root distance is minimum, so we can increase the density as per our requirement. And the third advantage with DHI is it gives absolutely natural result. You will not be able to recognize which roots were implanted and which roots were present before the roots that were present before the procedure. It gives absolutely natural result. So if you are planning to get your hair transplant done, in nutshell, for the benefit of for people who have seen this video, in the nutshell, you have to see for 3 factors. First, the most important factor is the doctor, his qualification, his registration number. Second is the procedure should be performed in a proper operation theater. And the third part is the procedure used to perform your hair transplant should be the latest one. Presently, DHI hair transplant is the latest procedure by which hair transplants are done worldwide. We do every hair transplant procedure in our clinic by DHI method only. All the procedures are personally done by me. I am a registered surgeon doing hair transplants since the last 15 years. My staff is permanent, has been working with me for the last 10 to 15 years. So we give the uniformity of results can only be possible if done by the same surgeon with the same staff. The marketing companies and the hair transplant clinics where multiple procedures are done and they have displayed some photographs of the celebrities, you should first inquire whether the doctor who has performed hair transplant on that celebrity, the doctor only will be performing the procedure on you, or there will be some other doctor who will be doing that procedure. So make sure the doctor you meet before should be performing your procedure. In India, because there are no strict rules, no protocols followed. So 95 to 99% of the clinics are run by technicians. They are not even a qualified MBBS doctor in those clinics. So make sure don't get your hair transplant or performed by such unqualified technicians that can risk your life even, and you will not get the results as per expectations. I am sure that by this video I was able to tell you about the important things, the things you must know and inquire by that clinic from where you want to get your hair transplant done before proceeding towards the actual procedure. If you want further clarifications regarding hair transplants and other hair loss treatments, you subscribe to our channel, you send any specific query in the comment section, or you can send the query directly on our WhatsApp number. This is Dr. Amit Singh signing off.